Well, welcome and thank you everybody for joining us today. This is Allie Orwig with the Indiana Rural Health Association. We're so pleased to see everyone today. Before we get started, just a couple quick housekeeping items. This is a webinar instead of a meeting. If you've attended some of our lunch and learns before, we have previously used the meetings. So this is slightly different in that if you're just an attendee, you won't be able to talk or ask questions verbally without getting prior approval from one of us hosts and co-hosts. We suggest if you have questions to use the chat or Q&A functions. Those can be accessed by hovering either at the top or bottom of your screen, depending on which view mode you are in. A little bar will slide down or pop up. I'm going to go ahead and send everybody a quick chat so you can see where that is. And I will keep an eye on that for our presenters today, both the chat and the Q&A functions, and we'll be able to have a period at the end of the session where we can address those. If anybody needs direct help during the presentation, please chat to me specifically. Again, my name is Allie Orwig, and I will be able to help you if you're having technical issues or anything like that. We are recording today's session in case you're not able to join us for the full time, and we'll have that archived. You can reach that through our website or through our YouTube channel, pretty accessible. But if anybody has any questions or needs anything after the presentation, I'm going to share my email address right now in the chat so you have that available to you. Now, without further ado, I'm going to turn it over to our excellent presenters today. We've got Deana Haworth and Marissa Smith-Kinney with us today, and I'll let you ladies go ahead and take it away.
Wonderful. Well, thank you so much for having us, and we really can't think of a more appropriate group to be talking about this topic with at this point in time. Marissa and I are going to share the presentation over the course of our time here, but certainly feel free to pop in with any questions as we go through. We'll also have some time at the end for some Q&A if you'd like to submit your questions then. We have a quick agenda here, so I'm going to talk some about our Rural Reach program and communications and engagement with rural communities, specifically the rural poor. We're also going to take a little bit of time, as you may have suspected, to talk about COVID-19's impact specifically on rural communities, which is starting to grab some pretty big headlines as of late. So I'll tell you a little bit about HIRONS, where Marissa and I both work. I'm the COO and she's our business development manager. HIRONS is located in downtown Indianapolis, but we also have a Chicago office as well. We are about 42 years old and are an agency that focuses on advertising, public relations, and digital activity. We are employee owned, so if any of you are ESOPs out there, you know a little bit about how meaningful that can be for a business. And we have a generalist approach. So we are experts in advertising, PR, and digital, but we serve all different kinds of clients and customers. About half of our work is in the government space, so highly regulated environments at the federal, state, local levels. And then the other half is what we call commercial, which is where a lot of our healthcare and public health work falls in. We have a very special relationship with both Facebook and Google due to our spend and campaign performance. So we have access to some really great data that helps to inform our programs like Rural Reach. We created Rural Reach in some part to support our healthcare clients. And we have healthcare clients really across the spectrum. So we not only work with important organizations like Eskenazi Health and IU Health here in our state, but we also do a fair amount of work in public health. And that has really been a big area of focus during COVID, of course, and we do some work in pharma and med device as well. So our Rural Reach program is a relatively new program for us. It's about 3 years old now, and it is really intended to help clients, and for us that could be business leaders like many of you, it could be nonprofits, it could be large corporate employers that have a footprint in rural America. And certainly there's been a lot of interest in the healthcare space for this program. So it is a combination of HIRONS collective experience, both in community engagement and education, but also really hones in on the fact that many of us grew up in rural communities, and many of us were rural poor as well. So if you see the really funny picture there on the screen, that is me holding the little Crayola case that has the pens and paintbrushes in it. So this looks like any family in, you know, Indiana in the early 80s, let's say, without fully disclosing my age. But what you can't see behind that is that this Christmas, my family, so my mom and dad and my brother, went to my grandparents on Christmas Eve. So when we woke up, there would actually be presents on Christmas morning, because my family, I was raised in Steinsville, Indiana, which, if any of you know where that is, in between Monroe County and Owen County in South Central Indiana. We have about 219 people in the last census, so a really thriving metropolis. But we were, my dad was an entrepreneur and my mom stayed home to raise us, and this was a really tough Christmas for us. So I have a lot of personal interest in engaging the rural poor and thinking of them as a very special audience. As we developed Rural Reach, it's really based on the premise that a rural community, specifically the rural poor, should be identified as a special audience. So we think of them just like in marketing and advertising. We think of LGBTQ communities, the senior community, low income community. We believe that there are some really special things about rural communities that should be celebrated and acknowledged at the same time, and that corporations and businesses need to really understand the rural communities. I know many of you are proud to live and work in rural communities, so hopefully you'll see yourself in some of what we're talking about today. As we rolled out Rural Reach, we consulted with a lot of different organizations to really fine-tune both the data that we're building the program from and our recommendations. So you see a list of some of those here. So we've stayed close to home in some cases, and in others we've really worked nationally, both from an industry perspective and with some focus in healthcare. So we presented a year ago at the SHISHMED conference in Nashville, where this program received a lot of interest from the communicators and strategists that were there.
Okay, so now that you know a little bit about us and about HIRONS, we're going to really dive into the reason you're all here today, which is to talk, of course, about rural America. As Deana said, you know, a lot of you may already be well-versed in this audience, and we love that. I know for me personally, I'm from a small town as well, so going through the data I'm about to show was helpful for me to kind of reinforce the things that I experienced on a personal level growing up. So first of all, when we talk about rural, we go by the US Census Bureau's definition, which is very broad. So any place in the US that is not urban is considered rural by the census. So that's about 97% of the US land territory. And it's also a significant chunk of the population, close to about 20%. So adults in rural areas, they are more likely to live in single family homes and more likely to kind of stay where they grew up in the same state. And we see the split here of that roughly 60 million, predominantly adults, of course, but there are about 13.4 million children within that demographic as well. When we talk about poor and rural poor specifically, we are going by the federal, again, the federal definition of what is poor. So that is the federal poverty threshold when we are talking about that audience. Here are some social differences, just real quickly. Rural, as you can see, is on the bottom of each chart, and urban is at the top in the light green. So in general, rural audiences, you're less likely to maybe have a bachelor's degree, and you're more likely to currently be married, and you're more likely to, there's more likely to be kids in your married couple household. And there is also less diversity when it comes to foreign-born residents in these areas as well. Economically, there are some key differences as well, of course, between urban and rural. So there is a higher percentage of rural people who own their homes, while home values are maybe slightly lower than urban areas, as you see in the second chart, more people own versus renting. And you do see a higher percentage of rural households that rely on Social Security earnings as well. I think a lot of the times when we think about maybe low-income audiences, some people might jump immediately to an inner city or urban audience. And as we can see here and with other stats, that's not always the case. When we talk about rural America, we try very hard to not make generalizations. So we talk about the data that we're sharing and everything, and that can tell you averages. But when we are talking about rural communities specifically, we try to break it down into these three different categories. So you have the communities that are chronically poor. So those could be ones that, they feel like maybe the recession from 2008 never ended. They have had consistent issues with poverty generation over generation. Maybe the town is just incredibly small. Maybe there's not a lot of access to education or other things that might spur economic development. And then we have those that are transitioning out of poverty. So that could be those where maybe a new employer has shown up to town in recent years, they built a new factory or something like that. There could also now be increased access to education. Maybe, a community college has popped up and helped people get the education they needed to pursue higher paying careers and things like that. And lastly, we do have many rural communities that are considered to be amenity rich. So, not every small town is this kind of portrait of a small place that's struggling. Some are very amenity rich and doing great on their own. So that could be those that have, river, mountains, lakes. We have the beautiful lakes in northern Indiana. We have our hills that are gorgeous in the fall in southern Indiana. Those are great examples of places where there's some sort of amenity that draws economic development in some capacity. And when we talk about, why rural America, it's important to note that a pretty significant percentage of Americans do have a preference for these rural areas, while only about 19% actually live there, as we talked about before. So close to 30% of respondents to a Gallup poll in 2019 said that they do want to live in a rural town or in a small town or a rural area. So that is just a great example. This could be a very lucrative audience for some of you, depending on the mission of your organization. Additional good news when it comes to rural living, there are higher rates of self-employment. So there's more entrepreneurs, and in general, your business, if you own your own business, is going to do better than in urban places. Again, with that community support. E-commerce is also something, of course, it has positives and negatives, but we do see that this kind of development of e-commerce on a national scale has spurred these kind of new factory towns, if you will, with places like Amazon. Additional assets of rural America, these are more social in nature. So you have volunteerism, entrepreneurship, resilience. What we see here is really these things that indicate these folks who are willing to do the work that needs to be done, whether that means that they are doing it themselves and not relying on outside help from external communities or government systems, and really coming together to collaborate and help each other. And again, this comes from a Canadian public health agency, but I would certainly attest that these things can be seen here in Indiana as well. So in general, rural living has a slower pace. There's less stress, less traffic, although I know that getting stuck behind a combine can be very irritating. There are lower housing costs, and again, you have that deeper relationship with your neighbors oftentimes. I know growing up, I knew all of my neighbors. I've lived in apartments now in Indianapolis for 5 years, and I've never met a person I live next to. Here are, of course, some negatives though. So there is isolation. If you are a service provider for your community in some capacity, you likely have to wear a lot of hats to accomplish the goals and keep the community thriving. Roads are often not maintained very well, and there can be higher costs associated with different services, particularly utilities. And there are, in general, fewer job opportunities and longer travel times associated with getting to school, going shopping, and especially access to healthcare. And Deana is going to talk more about healthcare here in just a minute. And again, internet and cell phone service can sometimes be spotty, expensive, or just completely unavailable, depending on where you are in these areas. When we talk specifically about rural poor, we are talking sometimes about communities that are part of the poverty cycle. So you see persistent poverty over a long period of time, and that does have cumulative negative effects. So it's important when you're communicating to those audiences that you understand their situation in a town that's been persistently impoverished for generations is going to be very different from a similarly sized town that maybe is doing better economically. So you see effects such as poor health, limited education. We also have poor housing and health conditions a lot of times. You're also, seeing higher crime rates, employment problems. Maybe more people are dropping out of school to seek employment to support their families. And again, as you saw on the map on the previous slide, those counties are generally concentrated in the South when it comes to those that are persistently in poverty. However, Indiana here locally, we have some of those communities as well. And Deana will talk about a case study here soon that includes one of those communities in Indiana. Broadband access, so internet access, as I mentioned, is a critical issue for rural communities. About 39% of rural Americans lack access to what is considered high-speed internet. There are differing accounts on who is able to have broadband access. So I'll look at a map here on the next slide that can just kind of illustrate that for you. Regardless, about 24% of rural Americans say that access to high-speed internet is a major problem for their community. Indiana alone could reap about $12 billion in benefits if we were to extend broadband internet access out into our rural areas. This, of course, has been a particularly problematic thing when it comes to COVID, especially as we think about people who are not able maybe to work from home for their job. And especially with kids, now we're getting ready to go back to school. A lot of families are going to be expected to be able to have their kids do e-learning with a 1-to-1 device ratio. So if you've got one computer at home, or you're used to just using your cell phone to get on the internet, and you've got 4 kids who now need to do e-learning, some rural families are likely to be scrambling. And here's the map that I talked about. So this just kind of shows the FCC's estimates about broadband availability says about 25 million people do not have broadband available. Microsoft data actually estimates that higher could be a lot bigger. So you see the 163 million over on the right side of the screen. That is people who do not use the internet at what is considered to be broadband speeds. So that could either indicate they don't have access at all, or maybe that they cannot afford it.
Marissa and I talked to a lot of different groups about rural reach across the country, and one thing that always comes up is healthcare. And I know this is near and dear to all of your hearts, but we're going to spend a few minutes here talking about the healthcare implications that those who live in rural communities are facing. So it's heavily researched and proven that your zip code means more than your genetic code. So if you are growing up and raising a family in rural America, you are more likely than your urban counterparts to experience heart disease, cancer, chronic respiratory diseases, stroke, and diabetes. We also know that cases of STDs are increasing, particularly in rural areas. Again, it's going to be that lack of access to healthcare and some really conservative views that persist in most rural communities. We also know that healthcare access is a real problem too. So families in rural communities are less likely to have routine sources for healthcare. Dental providers are becoming more and more scarce, and the availability of private health insurance is really limited. 1 in 4 is covered by Medicaid, but this is really shaping the way healthcare works in rural America. We also know that there are some really challenging pieces of the healthcare puzzle that plague rural America. So mental health services are very limited, and there are not a lot of great resources. So as you think of psychiatric care or the availability of a psychologist, you're at like half to 65% where there is no access. Addiction has really swept rural America as well. I've got a case study about the HIV outbreak in Scott County that happened a number of years ago in Indiana that I'm going to talk through a little bit, but we know that services are scarce. There becomes a family kind of legacy of addiction and a lack of ability to really get that care locally. So a lot of times people have to commute. We are very optimistic about telehealth and telemedicine as a possible solution there, but you know, we are starting to see in the addiction circles that people are saying, don't do drugs alone, make sure you're in pairs, and that one of you are able to either administer Narcan or call 911. So as we think of the really different environment that we're in with opioid addiction and more, it's really challenging in these rural communities. We also know that just the cost of healthcare has been a big topic of conversation, not only in rural communities, but nationally. And as you think of some of the low income implications that Marissa talked about earlier, affordability can really hit these rural communities very hard. And it even gets to the point where 26% say that they needed healthcare, but they didn't get it because of how much it was going to cost, which is just heartbreaking. We've also done, as an agency, a lot of work in public health as it pertains to COVID and the pandemic that is creating this new normal for all of us. So a lot of the early reports about COVID said that the hotspots were in densely populated metro areas. As time went on, you started to see articles and studies from epidemiologists that said that many places that are hard hit are these small cities and rural communities. It's just on a per capita basis that you have to look at the impact of that pandemic hitting those communities so hard. So what contributed to that is interesting, right? So they're older communities. There's an increased risk that you're going to have health problems that would make you more susceptible to COVID. There are many factories and other business organizations in rural communities where the workers have to be on site. Remote working wasn't even possible. So think of the meat packaging plants and other logistics companies that you're starting to see a lot of information about outbreaks in, and they in order to keep serving their customers and their communities, they had to stay open, and it was very tough. Many of them were plagued by the CDC's early advice that you didn't need to test people who were asymptomatic. And so as asymptomatic tests have become more popularized and mainstream, you're seeing a lot more numbers stack up in these industries. The broadband connectivity hits us hard on the business front. Marissa talked a little bit about how it impacts schools and school children and their e-learning, but as you think of the workers, it also gets very challenging for that. Now, telehealth was early adopted by rural communities. It's starting to see this comeback, right? And so as we all faced the shutdown and sheltering in place orders, you saw a lot of healthcare providers flip to telehealth, maybe more quickly than they could have imagined themselves doing it. But we're hoping that some of the kind of acceptability and support of telehealth will be helpful for rural hospitals and rural healthcare providers as well. So let's talk a little bit about how we think that you can best reach rural audiences. So again, we go back to our premise that reaching rural audiences and engaging them should be planned and very intentional, just like any other campaign or engagement from a marketing perspective. So we want you to think about market research. So as you are looking at your communities, and many of you have great resources in your community health needs assessments and other public health resources that may be available, but let's really understand your demographic, how it may be changing in the near future, how your audience members may be consuming media and how that's changed. We use some systems called Scarborough and Nielsen that even give us shopping patterns and lifestyle trends. As we talk about rural reach nationally, one of the things that I really hope folks take away is that there is no one-size-fits-all approach. So in Indiana, we may say that rural communities tend to be mostly white, don't have a lot of diversity, and are older. However, if you're looking out west, those things are probably not true, right? You're going to see a lot more diversity. You're going to see some different language requirements. You may see some different family trends and interactions as well. So I really want you to stay focused on that. We call them personas. So that person that you are trying to target with your campaign or with your marketing activity. As we think about rural audiences, we know that rural communities specifically are still relying on over-the-air broadcasting more. So they may be looking at their kind of traditional local news channels. We're still seeing some great use of local newspapers in rural communities. So we want to think about print in a different way in rural communities than we may think of it in more urban environments. And one of the triggers that we know for local news is the community's interest in high school sports. So those newspapers, and I'm assuming some of you are nodding thinking about this, but those newspapers are really the best way for parents and family members to get information about high school sports and maybe even the alumni that are in the community there. We also see radio as playing a big part in rural communities. So this hyper local radio where you're likely to know the newscasters, you're likely to have listened to this programming for a number of years, that local radio is really breaking through. Now, we're also seeing some use of Pandora and other streaming audio devices in rural communities, but we really believe there's still a place for traditional radio. We do know that in rural communities, people are heavily reliant on their smartphones, so they don't have the multiple devices that we're as likely to see in urban communities, but we know that they have their smartphones, and that is often even used as the hotspot to best deliver data for families and homes. So we've seen a lot of rapidly growing use of mobile technology in rural communities since 2011, and we expect that that will continue to increase and improve, especially as data networks follow along across the country. I also want you to think about digital targeting as a tool and not just discount them because you don't think people in rural communities use digital marketing tools. So let's talk about social media users. So social media is a really great option for low-income individuals. So think of Facebook and Instagram. It is the social network that folks are using to communicate. And as we are being forced to shelter in place and change the way that we're living each day, these social media platforms are just skyrocketing in use. Now, we do understand that not every community is going to have broadband access. Not every community is going to have great data. So we want to make sure that you're looking at those numbers and really understanding your truly local targets. I also want you to think about time of day. So many folks, as they are in a traditional business environment, like most of you would be, you are thinking about a 9 to 5, Monday to Friday work day. In rural communities, we're seeing a lot of the gig mentality. So they're working a few different jobs and kind of having a different work week. They may be working second or third shift. As we know, factory work is very important for most of our small communities across Indiana. So as you are thinking about timing and events and when your radio or TV spots may run, really think about what their lifestyle is and understand that some good old daytime TV may break through in a way that you couldn't have imagined. So I just want you to continue to think about your audience and how you may best reach them. We also advise organizations to think about community involvement and engagement as even more high stakes in rural communities. We want you to meet people where they are, and we want you to understand the community fabric of your city or town. So think about the impact of those large employers. So for instance, we work with a really large employer in Mitchell, Indiana. They have not only dedicated workforce that are very committed to building their entire career with the organization, but they have legacy employees who are maybe the second and third generation that has worked for that organization. So think of the impact of a community employer helping partner with you on smoking cessation, for instance. Think about the importance of them talking about diabetes prevention and what that partnership in a somewhat unconventional way can mean. I'm also a really big fan of WIC and other extension office offerings. So think of how you can partner in those communities and really break through and make a difference. Think about the community events. So if you have a popcorn festival or the Persimmon Festival or the Limestone Festival, think of those and how your brand and your organization can show connectivity to the community and say, you understand what is important to the community by showing up at events and other outings that are important to them. You're also going to see a lot of interest in the VFW, the Moose, and the American Legion. So think of the important role that veterans play in many of our rural communities. And then the faith-based community is going to matter a lot in these organizations as well. Again, very multi-generational, and many of these churches have been involved in people's lives for generations. We also really believe that relationships matter in small environments almost more than they matter in larger ones. So really understanding how the elected officials, whether it's the town manager, if it's a town council, if it's your township trustee, the school board, think about how those people really shape the community narrative, and that organizations like that can really help you as a brand and as an entity shape your relationship with the community. Those local business owners and entrepreneurs that we're seeing growth in, service organizations. So you have Rotary clubs who have like weekly meetings, right? And it's something that is iconic in the community. So think about how those can matter. And then also specific relationships with faith leaders. We find a lot of our work in mental health and addiction is helped by having great relationships with these faith leaders, because many times family members and others who realize that someone that they love needs help are most often likely to reach out to faith leaders, especially in communities where there's an absence of mental health providers like therapists and psychologists. So I wanted to take just a couple of minutes here, and I'll keep an eye on the questions if any of you have specific questions about what we've talked about so far. But I thought it would be interesting for you to learn a little bit today about the impact that we've seen COVID have on rural media consumption. So this is, how are the average people in your local communities changing their interaction with the media based on sheltering in place and changes in their work environment and their lifestyle? So we know 32% are spending more time on social media. Messaging services like Facebook Messenger and others have really sprouted. And we're also seeing a lot more people create and upload videos. So, you know, adults using TikTok is maybe one of the funniest things that's happened in all of this. Broadcast TV is, in our world, the big winner in COVID. So really local broadcast TV, specifically the local news, we're seeing huge spikes in interest and growth. And also TV news kind of understood early on what this could mean for them, and they started really focusing on COVID-specific broadcasts and studies and coverage, knowing that there were a lot of deep interest in this and what it meant for our communities. This is a good comparison of kind of how did rural communities change and react differently than their suburban counterparts did in how they were finding information and updates on the pandemic. So again, you're seeing clearly, broadly, broadcast TV and cable were winners. You don't see a lot of change in this consumption until you start seeing that, you know, radio and apps are kind of being used differently, and then the national newspapers and how radio plays in. But overall, this is very, very similar in use. So it was interesting to us as we spend a lot of time talking about the differences, that in this time of a global pandemic, usage and information source was pretty spot on between the two different communities. As we think of kind of what happened in Indiana broadly, and we're going to talk about TV markets, which are reported in DMAs. So it's a pretty broad swath of central Indiana that gets Indianapolis TV, right? So think of what your local news broadcast is, and that tells you what your DMA is. Some of you are in what I call Bermuda Triangles, where you might get Louisville, Indianapolis, and Terre Haute stations. So, but we think of them as DMAs, knowing that there's a little bit of mix on the edges. So Wish TV, which is in Indianapolis, did a study and shared a lot of great data with us. So they're seeing, again, a spike in news ratings. They did a very cool partnership with Indianapolis Public Schools, where they broadcast academic lessons, knowing that access was a real challenge. They also saw interest in it's designated market area is the DMA. So that basically means the footprint. And I think we'll look at some maps here in a minute that will help. I just got a question here. So news ratings are up and entertainment ratings are up. So people are consuming television, as we saw locally at Wish TV. Sadly, there were a few print publications that just couldn't make it through COVID. It was kind of that final straw. So you're seeing some changes in their print publications, and some national publications are even going out for the national publications, even broad dailies, are going to digital only, so no print delivery at all, which is, for a recovering PR person, a really sad time, because I literally grew up reading the print newspapers. So in Indianapolis, as we looked at what happened in the marketplace, and this gives you an idea of DMAs. So see, Chicago is in red, South Bend and Elkhart kind of hang together in green. You have Fort Wayne. Indy in our state takes up a big chunk of it. And then you're also seeing Terre Haute, and then Champaign even comes in on the west side of the state as well. And then we get down into Evansville and Louisville and Cincinnati markets across the bottom. So this is how we think about television. In Indy, we saw a decrease in things like automotive, sporting, and sports betting advertising, but these home improvement stores are printing money. There's a local owner of a garden center, and he says now every day is Saturday. Like, everybody is coming in. They don't even really remember what day it is. And so some places are winning in this pandemic. And then we're seeing a lot of that increase in entertainment and news programming like we saw at Wish. There aren't a ton of differences, but I just wanted, knowing that you all are a statewide organization, to share some of this information with you. So in Evansville market area, the broadcast TV, which is both news and entertainment, increased in adults 18 to 49. So again, this is that younger age cell. And then media partners, so these are the TV stations and the radio stations, are really pushing hard to offer to produce creative, because as you were required to shelter in place, you couldn't actually film the TV spots or tape the radio spots in person like so many of them were used to. So there's a ton of creative in our world that had to really find a new way of production. In Fort Wayne, again, you're seeing streaming audio and video up, and then they intentionally had their on-air personalities, so those anchors and reporters and broadcasters kind of stand up and talk more with their audience to keep news personal. In South Bend, again, like many others, they saw this substantial jump in viewing. So an 80 to 90% jump on their CBS and Fox affiliates, a 62% jump on their noon broadcast, which is like, these are crazy increases that we could have never dreamed would happen in the business. Terre Haute, which is a complicated market. If any of you are from Terre Haute, from a marketing perspective, we know when we run statewide campaigns that it's always harder to get Terre Haute to move on things or to change behavior or to adopt new products. So they've been using Zoom and other ways to get their news content to make sure that they have good audience interaction, and they are doing more stories per day. So doubling or tripling the number of new news stories that are out there. In Lafayette, household viewing is up 20%. That 25 to 54 age range is up. And then they have seen some good increase in advertisers like in the service industry. So people are spending more time in their homes than they ever have, most of them in their lifetimes. And so you're starting to think, oh, I should get my air conditioner looked at. Oh, I really need to get that toilet fixed. Or I talked to a furniture store owner last week, and he said that he has just been seeing an entirely huge shift in furniture sales, which who would have thought of that? But people are sitting in their houses on that lumpy couch and figuring out that this might really be the time to fix that. So I have a couple of case studies that I'm going to run through. So Sarah just asked, why is Terre Haute such a complicated market? If I could tell you that, I could be a millionaire. We sometimes think it's because it skews a little bit older, but we haven't really been able to find the answer to that. And I will tell you that Terre Haute is tough from a marketing perspective, kind of irregardless of your product. It's a fascinating environment, but really understanding how to break through and get people to move as befuddled marketers for a really long time. So we have a couple of case studies that I'm going to run into here, but I want to just make sure that you all are asking questions along the way too. So the first one I'm going to talk about is one that folks, especially those who work in public health, are always fascinated by. So we were tapped by the Indiana State Department of Health to help with public outreach and education when they faced a just terrifying spike in Hep C and HIV cases in early 2015. So this HIV outbreak really challenged the community. So they're in the southern part of the state near Louisville, if you're not familiar, but this town of Austin was hit by this massive outbreak of HIV, and it was very challenging because think of everything that we've talked about in the past 45 minutes about rural communities, specifically the rural poor, and add a public health crisis on top of that. So we had to go in, and our message was to get tested, right? Get tested. And then we also were promoting the needle exchange, which for any of you who are familiar with syringe exchanges in the state, it is a tough program to launch for a number of different reasons. I could give a whole presentation on syringe exchange, outreach, and education, but as you can imagine, the concept of giving folks who are addicted the tools to use drugs, it's very hard for people to wrap their minds around, but it is so important in stopping the outbreak of HIV. So we knew that we were going into an environment that was difficult. We did a number of really interesting things. One of them that was the most interesting was that, so they're located on I-65 South, and so they have several truck stops that had a high number of sex workers at those locations. So our concern, we always talk about how we're the crossroads of America, right? But our concern is that if the sex workers contracted HIV, and it could spread from the truck stops all the way across the US, literally from Scott County, Indiana. So we had to do a lot of education, both with the State Trucker Association, so IMTA, and then also we partnered really closely with those truck stops and put posters and education and outreach and did some real grassroots outreach there. We also used cable as a really important hyper-local education option, and reached out to the faith community and school systems as well. It was really heartbreaking to see what happened in Scott County. The high school sports and youth sports found that people weren't willing to come and play them because they didn't want to expose themselves or risk exposure. I mean, it was almost taking us back to like the Ryan White days of confusion, which was shocking. So we had that, and then our NDOT, or the Department of Transportation, wanted to be really helpful, and they put out flashing signs on the interstate, like those big construction signs that tell you there's a work zone ahead, that said, "Caution, HIV outbreak, do not stop." And so you can imagine the economic development impact that had on the organizations that were trying to make it there. So people were really had the best of intentions, and we had to work really hard to make sure that everything was adding to the solution and not damaging the community more. So the quick work that ISDH and CDC and the local health departments there did really helped contain the outbreak. Communication was a huge part of that, and working with news media. So one of the other challenges that we faced really early on was that the media tended to go to the testing sites and the needle exchange sites, and we had to reconfigure media relations activities to take the TV news trucks and others elsewhere, right? So they weren't focusing in on some place we wanted people to go, because if you were coming for medical services and you saw a bunch of TV news trucks, you would be very unlikely to walk up to the door, right? So just some things that we couldn't have imagined were great learning opportunities there, but we found some great things that we've applied to Rural Reach as we've developed the program. We also worked with the Indiana State Department of Health on an infant mortality effort that was a very high priority of then Governor Pence and the First Lady. And during the development of this campaign, which is intended to have pregnant women understand the importance of prenatal care and not smoking and taking their prenatal vitamins, and like those were the core pieces, plus safe sleep in the first year of the baby's life. Our goal was to help more Hoosier babies reach their first birthday, so from first breath to first birthday. To develop this campaign, it had to be a one-size-fits-all, right? So it had to work in Fort Wayne the same way that it would work in Floyd's Knobs. And so we had to really test this. One of my biggest aha moments in our testing was we had 3 different campaigns that we had developed that we wanted to share with either expectant mothers or mothers that had recently given birth. We did the affluent suburbs of Indianapolis, we did one in Paoli, and we did one in Fort Wayne. One of our triggers beyond geographic location was if they had taken part in WIC services. And when we did the focus group in Paoli, Indiana, I was shocked because we had 11 women. They were a very similar match to the 11 women we had talked about in 3 other locations. And these women knew the ABCs of safe sleep, right? Alone on your back in a crib. They could recite them to me perfectly, every single one of them, which I thought something has to be happening here. So as we further looked at the community, we realized that their local WIC program had received a grant and had really focused on safe sleep education for moms. And that peer-to-peer model that WIC uses is amazing, especially in these rural communities. And so that was my first time of like really seeing the true difference, that if a community comes together on a very specific public health topic, that they really can make a difference. We've got a couple of resources here. I can tell you that some of these are polarizing. If you haven't read Hillbilly Elegy and you are interested in this topic, you should take a look at that. But otherwise, here are some other great resources. And I will take a few minutes here to see if anybody has any questions that they want to pop up. Are we ever all going to get used to Zoom? I don't know.
This is Allie. I don't have any questions right now in the Q&A, and I think you have handled all the ones that came up during the presentation. But as you said, we will go ahead and leave it open for just a minute if anybody's got questions they want to punch in. Or if anybody wants to ask a question verbally, you can chat to me and I can make your microphone go live too. So that is an option at this point as well.
I would also just say, Allie has my contact information and Marissa's contact info, and we'll share that with you. If you all want to have an offline chat or learn anything else more specific, we are very passionate about this topic and really benefit from hearing from those of you who are doing this hard work every day in rural communities. Oh, okay. We have a question here. Any insights on going where people are during COVID? Yeah, that's a really good question. We have struggled with this in a lot of our public outreach and education activities. One of the best ways that we have seen organizations navigate that challenge. So, you know, how do you go to the festivals when there are no festivals? How do you go to the co-op meetings if there aren't any? So one of the best ways that we've seen people navigate this is to talk to the organizer. So take time and talk to that festival organizer, talk to your fair organizer, talk to the church that's maybe either not having services or doing them remotely, and see what you can do to engage. Most of them are flipping to electronic or some sort of streaming offering. So see if there's anything you can do to help, or a way that you may be able to provide information, do a special webinar similar to this, or even step up to provide funding support as a community organizer. I will just tell you that the people that step up and connect to these struggling organizations in this time and help either through support, manpower, goodwill, or money are going to be remembered, right? This is something that nobody could have imagined we would be dealing with and for so long. So still connect, remember those relationships matter, call and check in with your faith leaders, with your elected officials, see what they're doing and how they may be able to help you. They really want to hear from the healthcare sector. And I would just encourage you to just think like, they don't want to bother you, right? They know that you are busy, you have a mountain of work. Make sure that you're taking the time to reach out to them, tell them about what you're dealing with, what struggles you may have, and it's so important to them as they are thinking about policies and legislation and stimulus packages and all of that. So keep that connection both with the organizations and your stakeholders. Do not go silent.
Okay, well, we are coming up right at the end of the hour here, so I'll be respectful of everybody's time, and we'll go ahead and end today's presentation. Again, we have recorded this. It will be sent out to everybody who registered today, along with a post survey. I unfortunately didn't have the correct link when I chatted out to everybody earlier, So if you try to take that survey, it won't make a lot of sense, but in our follow-up email, you will get the correct survey link, and it's very helpful to us to have those filled out. It literally takes 60 seconds or less. So thank you everybody today, especially thank you to Deana and Marissa. Really, truly excellent presentation with great information. So we appreciate your time.